Hello, Jason.
You again, the great window shopper, Jane.
Hey, I'm here to buy something this time. Look, I even have a prescription.
Oh, really? What is it, statins again?
No, it's diabetes meds for my cousin.
Diabetes, huh? Looks like today's health fact just found its topic.
Does diabetes have anything to do with cholesterol? Or statins?
It sure does. Let's dive right in. Research shows an intriguing link between statin use and an increased risk of diabetes. In fact, a study published in JAMA Network found that statins are associated with a higher risk of diabetes in postmenopausal women. This is the key! This risk may be even more pronounced among the elderly, women, and especially Asians. In fact, for those on atorvastatin, a common statin, the chances of developing diabetes are higher if you're Asian. In simple terms, statin users in this study showed a 71% higher risk of developing diabetes compared to those not on statins. And this trend held true across all statin types.
That's shocking. And the risk varies by statin type and ethnicity?
Exactly. Plus, the weight. Another study by the Department of Non-Communicable Disease Epidemiology in London examined over 2 million individuals, with over 430,000 on statins. They found that people on statins had a 57% higher risk of developing type 2 diabetes, especially those using them long-term. Interestingly, the risk was higher in those without hypertension or cardiovascular disease. Plus, this risk grows with a longer duration of statin use and is more pronounced among those with a higher BMI. So, if you're on statins, consider adding 200 milligrams of CoQ10 daily. Statins block your body's ability to produce CoQ10, which is essential for any different part of our body, but predominantly mitochondria, which gives cell energy to function.
Wow, statins really do a lot. They could worsen diabetes in people who already have it?
Right. And they can even raise the chance of developing diabetes in people who've never had it before. So, if your cousin ever asks about statins, you'll have to pass along this knowledge.
Good thing you're here, Jason. Thanks. You're so smart.
So, how would you like to pay?
Debit, please. And I guess that's a wrap for today. Time for us to say goodbye. Hey, Jason, guess what? I don't feel nauseous anymore after stopping the statins.
Well, good for you. If you didn't stop, you might have ended up with a hemorrhagic stroke.
What?
Didn't you ask me about the side effects of statins last time?
Well, I used to take statins, but I feel so nauseous. Is that a side effect? I mean, yeah, but you didn't mention anything about strokes.
There's never an end to learning, Jane. Health facts are like sequels in a movie series. There's always something new coming out.
Ooh, intriguing. Then tell me about the connection between statins and hemorrhagic strokes.
All right, let's dive in. First, let's clear this up. Hemorrhagic strokes aren't technically a direct side effect of statins. It's more about what happens when LDL cholesterol drops too low.
LDL cholesterol? Isn't that a bad one out of cholesterol?
Good question. Most of us hear HDL good, LDL bad, right? So, doctors prescribe statins to lower LDL because they believe it's the villain in the cholesterol saga.
Isn't it, though?
Not entirely. It's a bit more complicated. Research shows that LDL does play an important role in our bodies, and here's where it gets interesting. This is the key! A study by the Massachusetts General Hospital and Harvard Medical School found that in patients with a history of a hemorrhagic stroke, taking statins actually increased their chances of having another one. For a hypothetical 65-year-old patient recovering from a hemorrhagic stroke, avoiding statins led to a longer life expectancy. measured by something called QALY, or Quality Adjusted Life Years. Taking statins decreased that number.
Whoa, really? But isn't lowering cholesterol always a good thing?
Not if it drops too low. A different study revealed that cholesterol levels below 4.14 millimoles per liter, or 160 milligrams per deciliter, could double your risk for intracranial hemorrhage. And, fun fact, it's linked to higher risks of liver cancer, pancreatic cancer, and even depression.
That sounds terrifying.
It is, and it gets more complex. Duke University found that men, older patients, and those with certain conditions were at higher risk of hemorrhagic strokes if they took statins.
So the lower the LDL, the higher the risk?
Exactly. Another study showed that patients with LDL levels below 1.4 millimoles per liter had an even higher risk of these strokes. So, while doctors prescribe statins to lower LDL cholesterol, going too low can have its dangers.
Oh, wow. So LDL isn't just a villain. It actually does important things for us.
Exactly. LDL cholesterol is equally important as HDL. Drastically lowering it isn't necessarily beneficial, it can even be harmful.
But if that's the case, why do doctors keep prescribing statins? They should know better, right? I mean, not that I'm doubting you or anything.
Jane, if you keep coming back with questions about statins, there'll be a day when I'll explain exactly why.
Oh, okay.
Well, that's a wrap for today. I guess this is the time to say goodbye.
See you soon. Hey, I just got a question in my head that I couldn't figure out. So I ran here.
Are you serious? What are you for? Can't even hold on to a question?
No, listen. I keep hearing about all these side effects of statins, and I'm confused. If they have so many issues, why on earth are they the best-selling medicine ever?
Well, maybe today's the day to finally get into it.
I'm ready. Lay it on me.
All right, let's dive in. So, here's what we know. Statins, super popular for lowering cholesterol, are often prescribed to prevent heart disease. But is their reputation as a miracle pill really deserved? Research shows mixed results, especially for older adults. For instance, one study led by Dr. Hahn and colleagues found no benefit when statins were given to adults 75 and older without a history of heart disease. Not only that, but there was a slight trend toward increased all-cause mortality in this group. Surprising, right?
Oh, Lord. These results are so surprising.
And here's where things get even more complicated. This is the key! While statins do help those at high risk of cardiovascular disease, their use in people with low risk remains controversial. Fiona Godley, an editor of the BMJ, pointed out that the debate over statins has become bitter and unproductive, with strong voices on one side advocating for statin use. Experts like Rory Collins, head of the Cholesterol Treatment Trialists, CTT collaboration, continue to call for the retraction of 2 BMJ articles that question the use of statins in low-risk people. It's both unreasonable and concerning that a powerful researcher would push to retract studies unfavorable to statins. This highlights an urgent need to investigate the side effects of statins and communicate them more transparently. Independent reviews could help address questions like, why were some adverse events due to statin intake were left out in trials? And did the run-in periods, where those with side effects dropped out before randomization, impact the results? These are crucial issues, yet we haven't gotten clear answers. Then we have alternative treatments, while we are not so sure about statins and other lipid-lowering drugs. A study published in New England Journal of Medicine found that niacin, a form of vitamin B3, performed better than ezetimibe, another cholesterol-lowering drug in terms of reducing artery thickness over time, suggesting better long-term artery health. It also came with fewer cardiovascular events. Now, I'm not saying niacin is the answer, but this study shows us that options beyond statins do exist, and we should consider them, especially like we lack certainty about a drug and its trial.
Yes, right. That's reasonable. Should take note of that.
So, why the statin craze? Well, it's possible that marketing, lobbying, and selective study reporting have all played a role. Statins were built up to be the magic pill. But at the end of the day, it's about individual needs and understanding the whole picture. Well, you look informed. Need some time to process all that?
Yeah, wow. That was a lot.
It's a lot to take in, for sure. But hey, don't run off with more questions just yet. This is just the beginning. We'll dig even deeper next time. This is time for us to say goodbye.
All right, I'll be back for more. See you soon, Jason. Hey, I'm back for more. Let's dive deeper into this whole statin and pharmaceutical company story. I gotta know what makes statins the #1 selling medicine.
Did you all catch the last video? If you're ready, we can dive in.
Who are you talking to? It's just the two of us here.
All right, let's continue.
Huh.
So, picking up where we left off, we talked about how pharmaceutical companies have pushed the statin story pretty hard. Today, let's look at another case, the story of Vioxx, a painkiller from the late 90s and early 2000s. Rise and fall of the Vioxx timeline was well sorted by Snigdha Praksh and Vicky Valentine. Vioxx seemed promising when it launched in 1999. It was supposed to be a safer alternative to painkillers. At least, that's what Merck hoped. But just a year later, red flags about its safety started popping up. By 2000, the company already knew it was causing heart problems. This is the key! Yet, they kept on selling it, making billions before finally pulling it from the market in 2004. It starts in early 2000. Merck, the company behind Vioxx, gets some concerning data about heart attacks in Vioxx users. But here's the kicker. They set a cutoff date for heart data before the trial ends. So, any heart problems after that? Not reported. Meanwhile, a lead researcher, Dr. Weinblatt, owns Merck stock with his wife and signs a $5,000 a day contract to advise them on Vioxx. Cozy deal, right?
What? $5,000 a day?
By May, Merck publishes their Vioxx study. They report 17 heart attacks, but the real number was 20. They leave out a few other problems too. Fast forward, studies estimated that around 88,000 Americans had heart attacks because of Vioxx, and 38,000 of those didn't survive. By leaving out those cases, Merck downplayed the risks for years. It's a textbook example of business goals taking priority over public health. And it's not just about one drug. Big organizations like the American Heart Association get huge donations from drug and food companies, and they're the ones who write guidelines pushing unhealthy diets and statins for millions of healthy people. Sound fishy? Journalist Martha Rosenberg pointed out that some statin guidelines now cover over 40% of men and 20% of healthy women between 40 and 75. And that risk calculator overestimates heart disease risk by up to 150%. So, it's like they're rounding way up to fit more people under statin prescriptions.
Whoa, wait. So you're saying?
Yep. The takeaway? These companies are businesses, not nonprofits. We should question the claims and look closer at the evidence. And actually, there's even more about statins I didn't get into today, like their potential connection to ALS.
Hey, spoiler alert, please.
Glad to see you're still with us, Jane. But I think it's time for us to say goodbye.
Wow, Jason, you fill my head with info and then just kick me out. You're a real piece of work. See you.